So, over the past 50 years, cell phones have become an everyday tool for over 5 billion people worldwide, propelling innovations in digital health. Digital health technologies can be especially beneficial for women who confront unique face to face care barriers like childcare and limited finances. But despite these promises of digital health still fails to adequately address women's unique situations. And so this leads me to the main topic of my presentation. How have digital health technologies impacted gender equity and not? And so first, let's discuss the shortcomings of digital health and their implications for gender equity. So firstly, digital health fails to maintain patient security, and this is especially problematic for victims of intimate partner violence or IPV. So for example, abusers who have access to victims' phones can monitor their location, access the health data an app collects, and even install spyware. In addition, if abusers discover resources for IPV victims on victims' phones, abusers might partake in further violence. Secondly, many digital health apps have biases in app design and algorithms. So one prime example of gender bias is in the Babylon app, which was created in 2017 by the UK National Health Service. Babylon uses AI to quote unquote diagnose patients based on self-reported symptoms and suggest a course of actions. And so, for example, a female patient or a female smoker aged 59 years old with symptoms of a heart attack received a diagnosis of depression or a panic attack. Meanwhile, a male user with the same background and symptoms was informed of the possibility of a heart attack. And so because AI relies on readily available medical information and gender bias is prevalent in medical research data, AI suggested different diagnoses for the male patient and for the female patient. Thus, instead of empowering women with accurate health information, these health apps could be hindering women by providing biased information and recommendations. And thirdly, digital health technologies fail to address social situations. And digital involvement tends to vary by gender, especially in rural and low and middle income countries. So to illustrate, women in low and middle income countries are 17% less likely than men to own a smartphone. And as a result, many digital health programs may fail to reach key populations. Notably, in Uganda, men participated twice as much as women in an SMS-based HIV campaign. And in the Democratic Republic of Congo, over 80% of callers on a family planning hotline were men. And so how can we address these inadequacies of digital health? So firstly, we need to improve security in app design to help make the cell phone a resource, not a liability for victims of IPV. So apps should help users understand what data is being collected, the privacy policy, and how to opt out of data collection. And when I say help users understand, I don't mean more long paragraphs that we all skip through and press I accept. This information must be easily digestible and so that we can empower victims of IPV to make informed decisions. Additionally, digital health apps should minimize personal data collection, especially for those who are vulnerable. Lastly, there should be better encryption for sensitive data, like patient health information, to reduce the risk of data breaches. Secondly, we need to reduce app gender biases and algorithms. And this can be done by including a diversity of users and app training data and working in a diverse team. Additionally, we should exercise caution when incorporating AI into these medical apps because AI relies on existing medical information and may present biased diagnoses. And lastly, we need to focus on research and education. We should research more about women's health issues so that these digital health apps can provide more accurate information and recommendations. Do more field research about the use of these apps in the real world, especially in rural and low and middle income countries. However, this research should not come at the at the expense of participant security and privacy. Moreover, we should promote education about mobile device encryption and how to access digital resources. And I hope my project helps address the inadequacies of digital health and encourages further development in the digital health sector so that everyone can live healthier lives. Thank you.